The question before us is whether competition can help to improve the system, which many believe to be in a state of crisis. Can competition lead to greater efficiency, better quality of care, and more accessible services? Or does it risk creating a two-tiered system with the wealthy having greater access to health care than the less fortunate? We're going to hear from both sides from our four eminently qualified debaters.
On the affirmative side, we are delighted to have at the podium Christy Clark, former Premier of British Columbia. Doesn't begin to do justice, but for the sake of introducing her and getting her quickly to the microphone, that is Christy Clark. We have also on the affirmative side Sean Francis, who is Chair and CEO of MedCan, among many other roles in business and in public life. On the negative side, and that doesn't necessarily mean that they're negative people, but we have Tom Mulcair, a former federal leader of the official opposition, much else besides. You'll know him, among other things, if you listen to the radio on a regular basis. And Dr. Danielle Martin, professor and chair, Department of Family and Community Medicine at the University of Toronto, and a very well-known and widely cited author on healthcare.
So we're all here because we all care about healthcare. That's why we're here. We care about the system. And for, I think, all of us, we feel like it's something that differentiates us from our neighbors to the south, when we often feel like there's precious little difference between us, although maybe not these days. And when we think about healthcare too, we think of it as a way to be equitable and to share with the people in our country. That's why we're here. But how do we save it? Because we are in the worst healthcare crisis that we've had certainly in my lifetime. And I think that the healthcare system is about to buckle if we don't figure out how we're going to deal with it and try and fix it. We have to fix this system. And we know that because we've had hundreds and hundreds of commissions and groups that have looked at it and told us almost all the same things that we need to do to fix it. And we've tried to fix it over the years. Some of those fixes have happened in different provinces in different ways. Very few of those have stuck. And so what we've done is we've decided the way to fix it in Canada is to just give it more money. And that hasn't worked. And my argument to you tonight is that we need real, profound reform in our healthcare system, something that we haven't tried in Canada, but it's being tried around the world, if we want to make sure that this system continues to work. Because healthcare budgets in provinces across the country eat up about 40% of all the revenue that governments spend. And governments are now cutting education in order to pay for healthcare. A healthcare system that was designed for the 60s, when there were a lot more young people than there were old people. A time when complex care wasn't something that was nearly as complex as it is now, a time when technology was different, a time when drugs were cheaper, all of those things. But we still have essentially the same system in Canada today that we had in the 60s, and we can't pay for it anymore. We have about 11 great healthcare systems in the world. The Americans is the 11th. It's the most expensive, and it has the worst outcomes. Ours is 10th. And we spend just about more than anybody else in the world. And I think what we need to do is think about how we introduce some competition into the system. And the competition doesn't have to be just from the private sector. We can create competition within the public sector if we can create accountability within this public sector. If we can measure the public sector, we have ways to work together. So I'm just going to give you 4 last points, Bill. The first is this. I think will frame the debate. First, we have to admit that in Canada the system is broken and we're prepared to do something to fix it. Second, we have to stop thinking about the only alternative to Canadian healthcare is the American one. Europeans are doing way better than us, and they have systems that are mixes of public and private. We have to remember that a public hospital-based system doesn't have to only be public or private. It can be both. And we have to allow choice where government monopolies exist so that patients and workers can decide where they want to be, and in doing so, create the incentive for our public system to try and do better.
I am so impressed that everybody showed up tonight after that superstorm. I had an inspiration knowing that there were going to be this many people. I left Montreal at our place in the Laurentians at 5 in the morning. When Poiliev is talking about the Laurentian elite, he's talking about me, because I actually live in the Laurentians. The day before yesterday, Ontario introduced Bill 60. Now, you'll never know it by reading the title or anything in it, because it all talks about integrated community health care. Good luck trying to find the word private in there anywhere. But we all know that that's where this is headed. So let's look a little bit at the history of how we came to our present system and what needs to be done to make the system much better for the future and for our kids. All three major political parties can claim some ownership of that system. That Christy correctly said, we've always liked to compare ourselves to the Americans. But now we've got to start looking at ourselves and what we're actually delivering, because the only thing that matters is results. All the rest is debate. We like debate, but we like results even more. We learned that during the pandemic, whether it was the Heron residence, where dozens of seniors who were in a private care home were left to die in their excrement, dehydrated. The same thing happened in Bobcaygeon. The Army had to be brought in. This was private care. But there was no enforcement because they had actually here reduced the number of people enforcing it. So I don't want to abuse, but I will say this, that when Christy says that when you have somebody who gets an infection and they have to go back to the hospital, if they've been in private care and the private care has received the money from the government, guess what? If they develop an infection, they're right back to the public system. So this has to be based on evidence, it has to be done step by step, and it has to be done, dare I say, the same way the first system was, with every single political party taking some credit for what has to be done to make it better.
2 words: government monopoly. The median wait time between seeing your family doctor for treatment has increased from just over 3 months in 1993 to 10 months this year. What they don't measure, because they didn't think they had to, was your wait time to a family doctor, which has also increased by weeks. And right now, there's 5 million Canadians who don't even have a family doctor. Consider, too, that the cost of public health insurance for the average Canadian has increased 100% since 1997. We spend 11% of our GDP on healthcare, more than 27 other comparable OECD countries. But among those countries, we're 31 out of 34 in acute care beds, 26 out of 31 in medical doctors, and 17 out of 32 in nurses. Emergency rooms across the country are routinely closed. Foreign medical professionals can't get licenses, and we have too few medical spots at universities. Currently, we have 1.3 million Canadians on a waiting list for a procedure, many life-threatening, and most recently, even the BC Supreme Court acknowledged that people are dying on the waiting list. And over the next 20 years, the number of Canadians aged 65 and older is projected to increase by 50% to 11 million people. Ladies and gentlemen, we don't have a healthcare system, we have a queue system. And we're out of money, caught in ideological dogma that has resulted in us having one of the worst performing healthcare systems in the world. Every system in the world that is superior to ours has a competitive, private alternative to the universal scheme. If Canadians want a world-class healthcare system, then they need to think world-class. Competition will ensure that we get there.
What did this broken queuing system we call Canada's healthcare system achieve together? Let me give you an incomplete list. We procured massive quantities of supplies and distributed them across the country. Personal protective equipment, swabs, a hand sanitizer, ventilators. We massively ramped up testing capacity. We stood up assessment centers, drive-through clinics, mobile outreach teams to go into shelters, long-term care, and congregate living facilities. We trained and retrained healthcare workers to do new forms of care. We instituted billing codes and protocols for COVID-at-home clinics and virtual care for people with acute and chronic medical problems. We opened field hospitals and tents in parking lots. We participated in clinical trials to determine which drugs to use and at what doses. We collected data about who was most impacted by the virus. Data, lots of it made transparently available, and we allocated resources accordingly when they were scarce, like testing, drugs, and vaccines. We moved patients out of hospitals that were overwhelmed, whether that meant from Scarborough to University Avenue or from Saskatchewan to Ontario. We sent teams of workers into long-term care facilities to try to stem the impact of decades of poor design, understaffing, profiteering, and under-resourcing on our elders. And we stood up one of the world's most successful vaccination campaigns, learning from early design mistakes and adopting community-based strategies that were unprecedented at that scale. For those of us at the front lines of leadership and care delivery, this meant getting up every single day for months on end and inventing new ways to do our job. The result was a world-class pandemic response, and the common thread was collaboration. It was coordination, resolving actually for once to eliminate competition, of which we have tons actually in Canadian healthcare. So let's be real, we have a long road of recovery ahead. It's going to be really hard. Service backlogs, human resources shortages, mental health impacts. The coordinated effort required will probably dwarf what we have just achieved. But we are charged here tonight with saving Canada's healthcare system. When my family member or yours starts hearing voices that aren't really there, when one of us steps out into the snowy street tonight and gets hit by a drunk driver, when our aging parents leave the stove on by accident, it's not competition that will save us. Only collaboration can bring us hope.
2 minutes. 3 points. The first is the shortages of doctors and nurses are actually a product of government monopoly. Governments decide across the world, in the Western world, how many medical spaces we create and how many nurses spaces we create. In the UK, they're talking about doubling the number of medical spaces that they have to try and create some capacity in the coming years. That is exactly an example of how government monopoly creates shortages. So that's the first thing. The second I would say is we did an amazing job in Canada in collaborating when it came to the pandemic. But so did Britain. And they have a mixed public-private system. And so did other countries in the world. Not all of them, but many of them are equally proud. And it wasn't a function of having public and private. I think it was a function of having countries that care about social equity like we do in Canada, like they do in the UK, like they do in France and Germany, Sweden and Denmark. And the third thing I would say is that competition between the public and private sector doesn't mean that the private sector is always privately funded.
I'm going to concentrate on a study that was done at Oxford and published in The Lancet last June. We're talking about having evidence-based decision-making. I'm going to read from it. Private sector outsourcing corresponded with significantly increased rates of treatable mortality. That's not an opinion. That's The Lancet. That's Oxford.
The shortage of doctors is not the product of a private-public mix or having competition between the two. We know that because in Europe they have an acute doctor and nurse shortage, and almost all of their systems are a mix of public and private. And so the problem is we have a doctor shortage and we have a nurse shortage because governments around the world, the developed world, have not educated enough doctors and nurses. And if we want to solve this problem, it's not by even thinking about this issue of public and private, which is totally unrelated. The problem is there aren't enough of them. We need more, we need to educate more, and that's a government decision that we have failed to make over many, many years.
There's no other system in the world that looks to Canada as a model. Every other system that's superior to our system has some mix of public and private providers and public and private insurance. There's simply not another example for Canada. And they have superior healthcare systems. So that's really my single point. We need to look at how other countries do it and find our version of that. And they struggle with the same issues with supply, acknowledging that, especially after COVID. But no one is saying, you know what, the answer to that is to create a Canadian-style monopoly.
We need online booking. We need transparency of information. We need coordination. We need to axe the facts. Like, none of that has anything to do with competition. In fact, as we all know, in a competitive environment, the incentive is for people to hoard their referral base. Indeed, what we see currently, I'm a family doctor. I was in clinic until 8:30 last night. Do you know what it's like to be on the sending end of that fax? It is not fun. I have no idea how long any given surgeon's wait time is for a problem. And when I send it to them, they could be 6 months, it could be 6 days. You could have a new grad that I've never heard of. I don't know where to send that information.
And it's not untrue that the system in France was built up differently. The same way the largest pharmacare program in Canada, which is in Quebec, was built up to include a hybrid model. But it's not true that there are not problems with the French system. There are huge problems with it because, as Dr. Martin correctly pointed out before, there are huge strikes going on, and it's not in one or the other, it's in both at the same time because the system itself has huge problems as well. So it's interesting. The comparative method is a good way to get information, but that's the information that informs the decision-making process. But what I've seen here with Bill 60 is you come in with the result and then you're trying to backfill to explain why that result, more privatization, was the right decision instead of doing it the other way around. We're putting the cart before the horse. Tony Blair once said to me, in public administration, there are only two things. There's that which works and that which doesn't work. Now, of course, I remember using that anecdote with some of my colleagues in the NDP, and they immediately tagged me as a Blairite, and it really hurt my reputation with my colleagues. But I do think that Tony Blair is a good model of public administration, so I have to say that I am in violent agreement with Christy Clark when she says a lot more could be done in terms of public administration. Now, she says they have hundreds of thousands of bureaucrats in BC. If that's the case, they should start working on it right away. But across the country, anybody who knows anything about public administration can tell you that there are better models that can be used, there are economies that can be had, and what is the only important thing, I'll say it again, in my view, it's the result. Even when we use the word outcome, that's a bit of jargon and rhetoric. The average person doesn't understand that word. Just results. Because sometimes we're having a debate about means, but we should be debating the results. And can we get better results? That's a concession that has to be made. One of my profs in law school told us that a good way to win over the court sometimes is to make concessions. So to the jury and to the others, that's a concession I'm willing to make. That we can do a lot better in terms of the administration. But I think that we have to go to the core here, which is the central argument that the more competition, but when we say competition, isn't that just a way to bring in more private care?
When you look at all of the best healthcare systems in the world, the alternative approach is activity-based funding, or having money follow the patient. The developed world's highest performing universal access healthcare systems all employ private providers in the delivery of universally accessible services, and they have activity-based funding for hospital and surgical care. They also importantly require patients to share in the cost of their health care, with exemptions for those in low income and the chronically ill, among other categories, to make a more informed decision about when and where best to access the healthcare system. Cost sharing reduces the demand for healthcare services and leads to a restructuring of a patient demand based on the cost of services. These top performing nations also allow all patients to seek care on their own terms with their own resources when they wish to do so, recognizing this reduces demand in the public scheme and allows individuals an alternative when the universal system is unwilling or unable to meet their needs. A private health insurance market would reduce wait times for most, if not all, Canadians based on the experience of all other developed nations with a universal healthcare system.
We're not actually changing Canadian healthcare here tonight. I know you're all shocked to discover this is just a pretend exercise. It's a debate, and they had to convince you of two things. The first is that the system is broken, and the second is that competition is what will fix it. In fact, the word is save it. And I think, there's an interesting list that Sean has just provided to us of a whole bunch of stuff that, look, dude, we've been doing activity-based funding in Ontario hospitals for decades. Where have you been? A lot of this stuff is already going on, actually, and none of it relates to competition.
The fax machine is now available to take the votes of the room in general. So if you could please find your clicker again. We would like to know your views on the question of whether Canada will save Canada's broken healthcare system.